Hi, I'm Eli with AME Insurance Services. After 20 years, one of the most common questions I get is what is the difference between a Medicare Advantage plan and a Medicare Supplement plan? They both work with Medicare, but they're built very differently, and choosing the right one can make a big difference in your cost and how you access care. Before we compare them, let's quickly review the parts of Medicare. Original Medicare is made up of Medicare Part A and Part B. They're administered by the federal government through the Center for Medicare and Medicaid Services, also known as CMS. Part A helps cover hospital and other inpatient care, and Part B covers outpatient medical services, such as doctor's visits, lab work, and many other tests done outside the hospital. On top of that, there are a few additional options you'll hear about, such as Medicare Part C, also called Medicare Advantage, Part D, which is a standalone prescription drug plan, and Medicare Supplement, which is also known as a Medigap plan. Now, let's break down the key differences so you can see how each option works. Medicare Advantage, or Medicare Part C, is offered by private insurance companies and takes the place of original Medicare for your medical coverage. These plans often have a lower monthly premium, sometimes even a $0 premium, but they usually use a network of doctors and hospitals. In many cases, you will pay copays as you use services, and some plans may require referrals or prior authorization for certain care. Now, if we compare that to a Medicare supplement plan, also known as a Medigap, a Medicare supplement plan works alongside of Medicare rather than replacing it. It helps pay some of the out-of-pocket costs that original Medicare would typically leave behind, such as deductibles and coinsurances. Medicare supplement plans usually cost more each month, but in exchange, you'll get more predictable costs and more flexibility. In most cases, you can see any doctor nationwide who accepts Medicare with no network restrictions and typically with no referral. So, which one should you choose? If you want a lower monthly premium and you're comfortable using a provider network, Medicare Advantage may be a good fit. If you want maximum flexibility, fewer supplies bills, and a more predictable experience, a Medicare supplement plan is often the better option. There isn't a one-size-fits-all answer. The best choice really depends on your healthcare needs, your budgets, and how you prefer to get care. If you'd like, I can help you compare your options and narrow down what makes the most sense for your situation. I'd like to take this time to thank you for watching, and I look forward to speaking with you. My next video will be on the Medicare late enrollment penalties and why you don't have to fear them. Take care.